I am Dr. Ahmed Lotfi. I'm a senior consultant obstetrician and gynecologist. I've been practicing in UK, New Zealand, and Middle East. My qualifications are MBCHB, master's degree, and MRCOG. There will be 3 videos about hypertension in pregnancy. This is the first one. Hypertension in pregnancy, by definition, it is the systolic blood pressure equal to or more than 90 millimeter mercury, with or without systolic blood pressure equal or more than 140 millimeter mercury of millimeter mercury. Increased of the systolic blood pressure by 15 millimeter mercury, or increase of the systolic by 30 millimeter mercury over baseline indicates hypertension. Prevalence and importance. This problem affects about 10% of pregnant women. Severe forms may cause maternal or fetal death. Eclampsia is the 3rd most common cause of maternal death. Guidelines to check the blood pressure. We check the blood pressure after patients rest for 5 minutes in a sitting position, uncrossed legs, bare left arm, elbow at heart level. Use calibrated monitor and correct cuff size. Record the systolic blood pressure at the disappearance of the Korotokov sound. Diagnosis. The systolic blood pressure equals or more than 90 millimeter mercury on 2 occasions, 4 to 6 hours apart. Systolic blood pressure equal or more than 140 millimeter mercury may also be present. Signs and symptoms. It is usually asymptomatic. Severe signs will present with headache, visual disturbances, convulsions, and coma. Complications will be discussed in the coming slides, but this slide is telling us about classification of hypertension of pregnancy. 2 types: pregnancy-induced hypertension or chronic pre-existing hypertension. Pregnancy-induced hypertension occurs after 20 weeks of gestation. It includes gestational hypertension without proteinuria and preeclampsia. The other type of pregnancy-induced hypertension is preeclampsia, which is hypertension and proteinuria. Eclampsia is preeclampsia with convulsions. Chronic hypertension detected before 20 weeks gestation or pre-existing may develop proteinuria later, which is called superimposed preeclampsia. Preeclampsia, mild, diastolic blood pressure equals or more than 90 millimeter mercury, proteinuria less than 3 grams in 24 hours during collection. Severe preeclampsia, diastolic blood pressure equal or more than 110 millimeter mercury, proteinuria more than 3 grams in 24-hour collection, plus laboratory abnormalities. Signs of severe preeclampsia. Symptoms: severe headache, visual disturbance, epigastric pain, oliguria, hyperreflexia with clonus, pulmonary edema, and generalized edema. Laboratory findings: elevated liver enzymes, low platelets. If the platelets is more than 150,000, it is a borderline. If it is less than 100,000, it is really thrombocytopenia. Serum creatinine is high, and these are the lab findings in severe preeclampsia. Eclampsia, by definition, tonic and clonic seizures in preeclamptic patient. Differential diagnosis could be epilepsy, meningitis, tetanus, or cerebral malaria. Complications of preeclampsia-eclampsia syndrome: abruptio placenta, pulmonary edema, renal failure, intracerebral hemorrhage, HELP syndrome, DIC. All these complications are life-threatening conditions. This will be the end of the first video about hypertension in pregnancy. Thank you.